All right, so this is a rough breakdown of what's covered on the exam. Now, they do have on the website the topics that are covered, but they don't really let you know how many questions per. This is coming from going back to 2004 was the last time they published this on their website. I've been told that it's pretty much the same today. Students that have recently taken the exam, they said, yeah, that's pretty much how it is, okay? So if you picture your CPT manual, because that's really the star, that's really what you mostly have to be proficient at, is understanding CPT procedural coding. The surgery section starts with the 10,000 series of codes to the 60,000. So there's approximately 10 questions on each of those. All right, and as we go through it, you'll see that, you know, the 10,000 is the integumentary system, 20 is musculoskeletal, 30 is respiratory, etc. And so what I am doing in this review class is really saying, okay, if I had to write a board exam with 10 questions from the integumentary system, and it's based on guidelines, what kind of questions am I going to write? And that's what I teach you. I teach the highlights of where there's guideline issues that you should know. Straight up coding, looking up something in the index, confirming it in the main part of the book, if it's that clear, that will not be on the board exam. They're testing you on coding guidelines, okay? So keep that in mind. And then after the surgery, we've got 10 questions on radiology approximately, 10 on path and lab, 10 on medicine. Okay, that's a CPT book. Then, then 10 on E&M, approximately 8 on anesthesia, 8 on medical terminology, 10 on anatomy, okay? So right there, 18 questions, maybe about 20, are on understanding medical terminology and anatomy. Now, those are the ones where you normally can pick up some speed. Hopefully you can get those done quickly. If you have not had a medical terminology course and you don't feel strong in it, then I highly recommend, if you have time, to at least get some flashcards and really drill yourself. There's some good sites out there. StudyShack.com is one where other students taking other medical terminology courses have made flashcards for themselves. So whatever you're studying, pop in, integumentary and test yourself. See how you do, okay? 10 questions on ICD-9, but like I said before, you could have questions on the surgery codes or the radiology codes that throw in diagnostic codes. And don't be afraid of that. Sometimes you can use them to your advantage. It can be like a tiebreaker if you're struggling with the CPT portion. I personally don't think that ICD code should be, if you're testing an examinee on surgery questions, then I think it should just be having CPT surgery codes in it. But they didn't ask me, so. All right, so 5 questions on HCPCS. Like I said, don't blink. Very, very short portion of this. Practice management is like this catch-all kind of phrase. Everyone's like, well, what's on that? So I did bring the CPC study guide from the AAPC that we'll go over. I'll show you some sections. In there is a chapter in the beginning that is where they're pulling information from. And I have a slide with some details on it that I actually just put together this morning.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.